good day. We are the fourth group, and today we're talking about how ethical principles guide the way we act and make decisions, especially in the fields of science and healthcare. Our topic is ethics, natural law, and action, and through this presentation, we will explore how this principle help us understand what's right, just, and moral in real life situations. For our task, we were asked to examine a local news report that highlights a major ethical issue in the public health and to analyze it using the natural law framework. We selected a case that, for us, clearly shows how moral choices can directly affect people's health, safety, and quality of life. The specific public health challenge we focus on is detailed in our chosen article. Our presentation focused in strengthening the vaccination drive combating pneumonia in the Philippines. Our source material is the article titled Expert Urge Stronger Vax Drive as Pneumonia Ranks for Top Killer, written by Maria Teresa Montemayor and published by the Philippine News Agency on October 23, 2025 at exactly 6:56 p.m. Before we proceed, let me introduce the group members. Arita Dizon, Samantha Rain Gabrido, Venice Lauren Villapranca, Nicole Garcia, Trisha Sandy Wayne Gonzalez, and Jasmine K. Felix, all from BSN 1-2. Now, to give us a detailed overview of the situation, I'll be turning it over to Nicole Garcia, who will discuss the summary of the event and the main ethical issue involved.
So good day everyone. Now that you have that small idea about the article that we are going to discuss today, we can now go on and further analyze it. So the article, of course, is all about an issue here in the Philippines about vaccination. So first, let's head on by who was involved in this article. So the ones that are involved in this article is Dr. Regine Solante and the Pharmaceutical and Healthcare Association in the Philippines. So they were the ones who's encouraging or urging the government to strengthen the vaccination drives here in the Philippines. So why are these people raising this concern and pushing the government to strengthen the vaccination drive here in the Philippines? It is because the pneumonia is ranking fourth to the leading cause of death here in the Philippines, which is alarming because we have all the tools to prevent it, but still a lot of people die because of it. So this report came out on October 23, 2025, which is very recent. This is basically just a reminder to us that even though there's a science and the tools to prevent this kind of diseases like vaccines, we still need better implementation, more awareness, and continuous vaccination campaigns. So now let's head on to the ethical issues that were observed in this article. So the main moral issue or the main moral dilemma in this article was our responsibility to promote public health through vaccinations versus the moral failure when people still die from diseases that could have been prevented. So the big question here is, are we doing enough to protect people's lives when we already have the means to prevent these deaths? This becomes an ethical concern because it doesn't only revolve around medicines. Some communities still don't have enough access to vaccines, while other people still refuse to get vaccinated because they lack information or proper education about how vaccines work. That's why the government and the healthcare workers have an ethical duty, and that is to protect people's lives, educate people, and make sure that vaccines are accessible and available to everyone, lalo na sa mga marginalized communities. So ethically speaking, when people die because of something that is preventable, like pneumonia, it is not just a public health failure but a moral failure to us because it questions us whether we are doing enough to preserve life and promote common good. We'll connect this further in our next part, which is the natural law analysis.
Moving on, we have our principles of natural law to the case. First is the preservation of life.
The principle of preservation of life emphasizes that every human being has a natural right and moral duty to protect and sustain life. According to natural law, life is sacred and must be preserved whenever possible. In healthcare, this principle guides actions that prevent harm, disease, or premature death. So, how does this apply to our case? Promoting and administering pneumonia vaccinations directly aligns with the preservation of life. Pneumonia can be life-threatening, especially among vulnerable groups such as the children, the elderly, and individuals with chronic illnesses or weakened immune systems. Vaccination prevents severe infections, reduces hospitalization rates, and saves lives. Second is the pursuit of truth and honesty. The pursuit of truth and honesty means individuals and institutions have a moral responsibility to seek, share, and act according to the truth. In the context of healthcare, this includes providing accurate, evidence-based information so that people can make informed health decisions. Again, how does this apply to our case? Health professionals and institutions must share honest, factual, and science-based information about the pneumonia vaccine, its benefits, side effects, and safety record. This helps counter misinformation and builds public trust in healthcare systems. Deception, withholding data, or exaggeration would violate this natural law principle because it misleads the public and endangers health. Fourth is the promotion of human dignity. Promoting human dignity means valuing every person's right to life and health. The article highlights that pneumonia is a preventable disease through vaccination. By ensuring that vaccines are accessible to everyone, especially children, the elderly, and people with chronic illnesses, we respect their dignity and affirm that their lives are worth protecting.
And up next is reason and responsibility. Reason and responsibility reminds us to act wisely and take accountability of our choices. Healthcare experts mentioned that pneumonia causes over 46,000 deaths and billions of healthcare costs that could have been avoided through timely vaccination. This shows that our responsibility both as an individual and as a society to support immunization programs and make informed health decisions. And lastly, common good. The principle of common good emphasizes cooperation for the benefit of all. The article called for a whole-of-society approach, where government, private sectors, and communities work together to increase vaccination coverage. When more people are vaccinated, we protect not only ourselves, but also those who are most vulnerable, creating a safer and healthier community for everyone. So, in conclusion, the light against pneumonia is not only about health but also about values. By promoting human dignity, acting responsibly, and working for the common good, we can prevent unnecessary deaths and build a stronger and healthier nation. Thank you.
Good day. I'll be sharing the social position of this issue and how it connects to the nursing field. In the article, it was mentioned that pneumonia continues to be the top one causes death in the Philippines. Even if it's a preventable disease, that's where nurses come in. Because we're not just focused on bedside care. We also are educators ourselves, advocators, and community partners. As nurses, one of our ethical responsibilities is to promote health, prevent illness, and protect our patients' welfare. This includes supporting vaccination programs and helping people understand why prevention is so important. When we talk about ethics, we think about the principles we follow as nurses, like beneficence, non-maleficence, and justice. Promoting vaccine is an act of beneficence because we're doing what is good for our patients and preventing possible harm caused by diseases. It's also about justice because we make sure that everyone, especially those in remote or poor communities, gets equal access to healthcare services. In situations like this, our role is to also build vaccine confidence. Many people are still hesitant or afraid to get vaccinated. And that's where our communication skills come in. We have to educate them with empathy and respect, giving clear information about how vaccine works and why they are safe. By doing that, we help reduce misinformation and encourage trust between healthcare workers and the community. Aside from that,
We also need to recognize that vaccination is more than just a medical task. It is a moral and professional duty. When we help protect people from diseases, we're preserving life, which is at the heart of nursing practice. Every shot we give, every patient we educate, and every family we guide contributes to the bigger goal of a healthier society. This issue teaches us valuable lessons for our profession. It reminds us that being a nurse means an advocate for health and equality. We must always be compassionate, fair, and proactive. Health education and advocacy should part of our daily work, not just during outbreaks or emergencies. We should continuously promote preventive care because it saves lives and lessens the burning of hospitals. In the end, our role as nurses is not about treating those who are already sick, but also preventing illness from happening in the first place. Through education, advocacy, and compassion, we can make a real difference in people's lives. That's what the issue show that hers vital position in society, serving as both protectors and educators in the fight against preventable disease like pneumonia. Thank you.
So, hi everyone. So, I'll be explaining our conclusion part. Basically, in this part, we want to point out that until now, pneumonia still has a huge impact on our country. Imagine, pneumonia is still one of the leading causes of death in the Philippines. But the good thing is, it's actually preventable through proper vaccination. Now, connecting this to the concept of natural law, it teaches us that human life is sacred and it is our duty to protect it. So when we advocate or starting vaccination drives, it's not just an ordinary health campaign. It becomes a moral and ethical responsibility to safeguard people's health, especially the vulnerable ones like children, the elderly, and with chronic illnesses. As future nurses, we have a big role to play in this. We need to educate our communities, correct any health misconceptions, and encourage everyone to get vaccinated. So, as future nurses, let's continue to be instrumental in building a healthier and more informed community. At the end of the day, we're not just doing this because it's a requirement, because we want truly to protect the human life, which is actually what natural law teaches us, to do what is right and to act for the common good.